There is so much to wade through. The crucial part, of course, your response to what you've been hearing from the Prime Minister. 0344 499 1000. Welcome to the latest edition of Groundhog Day, or Deja Vu for the intellectuals. Every morning, by the way, we tirelessly search for those dominating issues, praying that something more pressing will hit the newswires and we can throw it out there for some good, healthy national debate. Sadly, it didn't come to pass, not today at least. To coin a phrase, we've been caught by the COVIDs once again. Not nice. It was late last night, of course. The Prime Minister announced that there'll be, it was leaked. It was leaked from the Prime Minister. Announced they'll be closing pubs and restaurants from 10 o'clock. By the way, is that likely to make a difference? 0344 499 1000. This is about an hour earlier than usual. Really? Is that the big headline in tackling coronavirus? Close the pubs? Pubs closing early? My knowledge of virology and epidemiology has been mostly from the dozens and dozens of guests I've interviewed on this issue over recent months. I can't imagine many of them putting their name to a policy like this. Is this really where we're at? Closing the pubs 60 minutes earlier than usual? You don't win Nobel Prizes for that kind of caper. Can you imagine in years to come when they look back? How did they solve the pandemic? Was it a vaccine? Did the good and the great from the world of science and microbiology put the might of their collective wisdom together and concoct the ultimate medicinal compound? Was it that? Or was it a world-leading sociological strategist who mapped out behaviour patterns of human beings, concluding that it was never 2 meters, but it was 3.1 meters that solved the puzzle? No, it wasn't that. It was pork scratchings. First noted by Bob, the landlord at the Queen's Head in Billericay. Stop selling pork scratchings at 10 o'clock rather than 11 and just watch the virus disappear. Right. In a case now known, by the way, or it'll be known in years to come as Bob versus the WHO, won't it? They eradicated the virus through not flogging beer and crisps after 10. Who needs scientists? Joking? Well, not quite, because this is the biggest headline of what Mr. Johnson is telling us. You can go back to work, but they'd rather you work at home if you can. So we know that much. You can still go to university and school, but be careful. Keep washing your hands. Keep wearing your mask. Biggest headline here. Don't go to the pub. In fact, if you go to the pub, you'll have to come home at 10. Restaurants, 10 o'clock, closed down, shut, finito, finished. Is that, as far as you're concerned, likely to work? 6 months, by the way. 6 months of this. This is not a 2-week jobby. He said it's not a second lockdown. It looks remarkably like some kind of lockdown to me. Let's just remind ourselves then a little more. The 5-point plan, if you like. This was what Mr. Johnson told the House of Commons in just the last 40 minutes.
First, we are once again asking office workers who can work from home to do so. Second, from Thursday, all pubs, bars and restaurants must operate a table service only. Together with all hospitality venues, they must close at 10 p.m. Third, we will extend the requirement to wear face coverings to include staff in retail, all users of taxis and private hire vehicles, and staff and customers in indoor hospitality, except when seated at a table to eat. Fourth, in retail, leisure and tourism and other sectors, our COVID-secure guidelines will become legal obligations. Fifth, now is the time to tighten up the rule of 6.
There it is. Tighten up the rule of 6. Top of the list there. Closing the pubs an hour earlier. Is that likely to make any difference to you? 0344 499 1000. I know Mike talked a lot about the letter from the scientists asking the government to rethink. We'll be speaking to one of the signatories of that letter in just a little bit. Group of scientists and doctors who wrote to the Prime Minister urging him not to opt for a second lockdown and to stop presenting COVID-19 as a mortal danger. 32 top academics, this was, calling on Boris Johnson and his scientific and medical advisors to avoid a knee-jerk reaction to rising cases and hospitalisation. Does that sound to you like a knee-jerk reaction, what you've heard the Prime Minister say? 0344 499 1000. And let's have a listen to what he said about retail, leisure and tourism. In fact, we can now have a little listen to what he said about the issues surrounding the retail industry, the leisure industry, and of course tourism as well, because these are three crucial components that, remember, have suffered really badly over the last 6 months and widely seen as the areas that will be responsible for kick-starting the economy. Have they come to a halt again?
In retail, leisure and tourism and other sectors, our COVID-secure guidelines will become legal obligations. Businesses will be fined and could be closed if they breach the rules.
So this is stricter stuff, right? This is sounding to me like stricter areas and trying to kind of have your cake and eat it a little, Prime Minister, I think. Here, we're not closing down, but we've got a lot of restrictions, a lot of fines taking place. We're doubling down on the rule of 6. We're going to keep the messages going. The pubs, the restaurants, leisure industry, face masks in more places than before. And this could all go on for 6 months. Now, I will await the advice that I get when we speak to the next guest, the professor, on this point, and she has been quite unequivocal. This is Professor Sunetra Gupta, Professor of Theoretical Epidemiology from the University of Oxford. She was on Question Time last week and caused quite a stir. We'll hear what she says in response to this. We'll also talk to Harry Cole, political editor of The Sun as well. Crucially, of course, it's how you feel about this. Does this affect your job, for example? Because I can't see now, just as we sort of got used to trains getting a little busier, a bit more footfall in the high streets, just a little, it was just a turning point. This is reverse gear territory, right? This is thumping reverse gear territory. What the Prime Minister did there, I mean, very cleverly, by saying, well, you know, it's not a lockdown, but we're just going to have all of these measures in place for half a year, on top of the half a year we've already had. We have closed our economy for a year. Get your head around that for a second. Let's speak with Harry Cole, political editor of The Sun. Afternoon to you, Harry. This one, of course, has royally divided the room, it seems. Do you think the Prime Minister, in his heart, the core of his philosophy, actually believes his own words?
Yeah, I think he probably does. However, I think this also could have been a lot worse. There were big fears in his cabinet and in the Tory benches and around Parliament that we were heading for a much more stringent lockdown. But actually, the measures that the PM has announced, the 10 p.m. curfew on pubs, the reduction of sizes at weddings, these fall far short of some of the other measures that in Northern Ireland, for example, involve households banned from meeting indoors, and whole areas of England who are currently under much more stringent and stricter rules. So I think those that feared a second lockdown will be pleased with this, but he did warn, however, that if this doesn't work, more dramatic action will be needed.
Yeah, I mean, he's talking 6 months here, Harry. 6 months of pubs closing at 10 o'clock and then reiterating that, well, don't go to work unless you have to, which kind of is slightly at odds with the emerging message we've been getting over the last couple of months.
Absolutely. I think the presentation by Chris Whitty yesterday and Patrick Vallance has certainly put the fear of God up Downing Street. And just a week ago, the Prime Minister was saying he had to consider closing the pubs, but it's not something he wanted to do. He had to consider. He still wanted people working from home where they go, working from offices where they can. But what a difference a week makes, and it's just that number, which that graph we all saw yesterday, that's clearly sent a chill down Downing Street.
Yeah, but again, it comes back to the dividing the room. There's these academics and scientists. We'll be speaking to one of them shortly that co-signed this letter to the Prime Minister suggesting not to go down this road. I mean, they're clearly at odds with Whitty and Vallance on this, but Mr Johnson clearly comfortable with the advice he's getting from those two.
Yeah, I think that it's an awful situation for anyone to be in, but it's on the one hand, he's got to be guided by the health implications of the nation. On the other side, the economic implications. And, obviously, science is never, there's always disagreements. That's why the whole "we're following the science" was always a bit of a dubious catchphrase in the first place, because, there's always different interpretations, there's always different opinions. However, it's all very well for various scientists to, muse and opine at length. It's not going to be on their heads if the death toll, doubles again and thousands more people die, as they fear it could.
Do you think that's really what's frightening number 10. It's this idea that we've had this disproportionate death rate and numbers, etc. The idea of going through that again is something that Mr. Johnson is desperately trying to avoid, despite similar numbers and problems in Spain and France and Italy and the like. Is it really those damning headlines he's avoiding?
Well, I think there's been an argument that Britain was too slow to lock down in the first place, and that's always going to be an accusation that's hung around this Prime Minister's neck. And so there is a school of thought that he's actually, in a way, being too cautious this time in order to avoid that again. But it's a balancing tightrope, and the difference between the idea of the death rate going back up even to 200 a day is a horrendous thought. And I think for an hour's drinking in the evening, if they genuinely do think that can stop it, then I think the public will be behind them.
Harry, thank you. As ever, Harry Cole is the political editor of The Sun. Let's speak to Professor Sunetra Gupta, Professor of Theoretical Epidemiology, University of Oxford, one of the 32 scientists who've written to the PM urging him not to opt for a second lockdown. Professor Gupta, afternoon to you. What did you make of this? Does it sound like it's sort of a bit of a lockdown? Would that be about right?
Yes, but first of all, can I just address something that Harry Cole just said, that it was not on our heads, and that's not true. I think most of us believe we belong to a responsible society where if, as a scientist, you step out as we've done and said, this is what we should do, it is on our heads. So we take responsibility, and we may not have to suffer the same consequences, but we do. Which is why we feel that essentially these sorts of disagreements among scientists could be bypassed, we could sidestep those by putting in place a system whereby we protected those who are likely to die from infection, because that's what we're really interested in, isn't it? It doesn't matter if the infection spreads through and it doesn't kill anybody. So we can achieve that by protecting the vulnerable. And the wonderful thing about it is if we allow the infection then to spread naturally through the population, we will build up enough population-level immunity, which some don't like the name herd immunity for that, but that's just what it's called. Sure. And that will bring the risk down for those who are vulnerable, such that they may resume normal lives. Now, I don't know that these small measures will help bring down the risk of infection to the extent that the vulnerable people will actually enjoy the benefits. However, far be it from us to oppose some form of control of the spread of infection, but it has to be placed in context that this infection is going to be with us. The notion that it could have been eliminated was really silly, actually. And so we have to live with it, and we have to come to an accommodation with it. The sooner the better. The sooner we do that, we'll be at the same level as with other respiratory infections, and then we can just go back to what we used to do.
What is it? The world of science, like the world of economics and any other profession for that matter, obviously divides in these areas, and there's lots of different theories and ideas that underpin the way we should respond to something such as this. But yourself and the others that have signed this letter, and I've heard you and read a lot of what you've talked about in this area. It seems to make perfect sense to me. I'm no epidemiologist or virologist, but nonetheless, I could get my head around it, and it's something that we've been arguing on this program. Have a good ring-fenced approach to the real vulnerable. That can't be beyond the wit of mankind. Big focus in that area, and essentially let everybody else get on with their lives. We had a caller yesterday, a guy called Dan called the show, made the same point, the one that you're making here, Professor. What is it then that you see and your co-signatories see that, for example, Mr. Vallance doesn't see?
Well, I guess the critics would say the point that you just raised, that it will be very difficult to shield the vulnerables, that the infections will percolate into the vulnerable population. Now, I have to agree with you. How hard can it be? It surely can't be harder than scraping the economy up from the floor once it's been destroyed by this, or rescuing the youth and the disadvantaged people, not just in this country, but internationally, surely that's the bigger problem. So there's the issue of the scale of the problem and also whether this is doable. We're not suggesting that it's easy, it's a doddle to protect the vulnerable.
Of course.
But surely we can break that down, and hopefully in the next few weeks, the conversation will be around how we can do that. And overall, I think we're all agreed, scientists, politicians, that we should protect the vulnerable. So there's the care home issue, which hopefully we can deal with quickly. There's making the hospitals more more COVID secure. That's what we need to make COVID secure, not the schools. But at the same, we really have to be attentive, I think, to the needs of the of children, of the youth, people in training. We should put their needs first, I think, not to mention those who are disadvantaged and will really suffer if we bring in a sharp lockdown. Sure. So maybe the pubs closing at 10 isn't such a bad thing in that regard.
Yes.
It's not going to affect the kids, is it?
Yeah, but I doubt also that it's going to solve a global pandemic either in that respect. But I suppose, I mean, it's fascinating to me. I hear politicians stand up and they say, well, there's another 2,000 cases today, with this sort of panicked look. And I think surely that they're actually answering a question that doesn't need to really be asked in that respect. That isn't the story, is it? If there's 2,000 cases on a certain day, that shouldn't be the headline, but it seems that it's those kind of statistics and numbers that is driving policy.
Well, certainly, I could not agree more that the way it's presented, the problem has been presented, is not ideal at all. So just as you say, focusing on the numbers of cases is really quite, it really doesn't help.
Yeah.
Because cases have to be seen in the context of how much testing there's done, what is being reported in the first place. So we know that some of these tests that we do pick up virus that's been lying around doing nothing for, 60 days even. And so that's not really giving us a very clear picture of what's going on. So there's the context of what does it actually mean? I mean, what percent of the population is actually infectious at this point in time? But then also the context of what is that in comparison to, for example, influenza? What do we normally live with? And I think one sort of heuristic we could adopt is to sort of start thinking in terms of what do we normally live with? What kind of prevalence of disease and risk of disease from these other respiratory pathogens do we live with? We know that flu, can cause up to 20,000 deaths a year. So we don't rush around locking down for flu. So why don't we do that? And if we're willing to accept that, we can keep that as our kind of, we should foreground our discussions in that context, I think. And that's not really done.
And indeed, and just a final point from your professional perspective, where do you, I mean, Mr. Johnson just spoke about this being these new measures, again, not quite a second lockdown, he was at pains to point that out, but for some people, they will see it that way in terms of livelihoods, in terms of what it might do for waiting lists in hospitals, for other treatments that could still compound the existing problem that we have, 2 million people waiting for cancer follow-ups and things like that. That's just one obvious example. But if you follow this through and 6 months down the line, where do you suppose we might be? Because from everything I'm reading, I can only imagine we'll be in perhaps regrettably, a very similar situation to the one we're in today.
Well, fortunately, the recommendations have not been for a really strict full lockdown or for a so-called circuit breaker, very unfortunate terminology.
Yeah,
so
who came up with that?
Hopefully within these restrictions, we can find a balance whereby we keep infection levels down, perhaps, although I don't know how you can judge that from, I don't think you can model restrictions and what effect they will actually have on cases. I think that's not a science really, but perhaps within what's been recommended, we can find ways to patch up the damage that's already been done, catch up on the other consultations, the damage that's been done to other public health services, shore up our school children. We really must do that. the youth going to university. We have to let people return to university, teach them face to face. There's no risk to most of us for doing that. And also young people in training, young people who cannot work from home.
Sure.
How can you ask someone to stay and work from home if they don't have a home?
Yeah.
So maybe we can attend to those within the framework that's been laid out.
We hope so. Professor, it would be lovely if we can speak again, because it's been great to get your expert view. We'd love to keep in touch. Thank you. That's Professor Sunetra Gupta, Professor of Theoretical Epidemiology at the University of Oxford, with us here on Talk Radio. She wouldn't say it, but I can tell you now, she is one of the most leading experts in this area on the planet. There are few more qualified than the voice you just heard. That is not a voice that is going into Boris Johnson's lug holes at the moment. He's more a Valence witty man than a Gupta man, it seems. Where do you sit on this one? You heard what a global expert just said.